The Genedrive COV19 ID Kit, a rapid point-of-care molecular test that delivers positive results quickly in as little as 7.5 minutes. The Genedrive COV19 ID Kit is designed for the qualitative detection of RNA from the SARS-CoV-2 virus in nasal mid-turbinate swabs. To run the test, you will require a Genedrive instrument. The Genedrive COV19 ID Kit contains all the components needed to perform a test, including a collection swab, a specimen collection tube containing buffer, a Genedrive assay cartridge and lid, and a transfer capillary. Each box also contains one positive and one negative control. A nasal mid-turbinate swab is taken from the nostril by slowly rotating the collection swab for 15 seconds before gently removing. Next, the collection swab is inserted into the specimen buffer in the labelled specimen collection tube and rotated for 15 seconds to release the specimen. When removing, gently squeeze the swab against the buffer tube on an area free of liquid, replace the screw cap and dispose of the collection swab. If there is extensive solid debris present, or the buffer appears turbid or blood-stained, discard and repeat. Remove the assay cartridge and check the lyophilized reagents are located at the base of channels 1 and 2 only. Label the assay cartridge lid. Open the lid. Remove the strip cap from the assay cartridge and place it in the lid holder assembly, ensuring the correct orientation. Invert the specimen collection tube 10 times to mix. Remove the screw cap from the specimen collection tube. Hold the tube at 45 degrees. Then, using the transfer capillary in a horizontal position, submerge the tip into the specimen buffer. Draw up the specimen until it reaches the black line on the transfer capillary. Keeping the transfer capillary horizontal, transfer the specimen into the assay cartridge. First, fill channel 3. Expel all the liquid without bubbles. Repeat for channels 2 and then 1. Replace the screw cap on the specimen buffer tube. Close the assay cartridge lid and push down fully. Squeeze together tightly until a click is heard. Holding the assay cartridge lid firmly, sharply flick the cartridge downwards, forcing the specimen to the bottom of each channel. Tap the tube with a finger flick motion to ensure any bubbles present move to the top of the channel. Visually inspect that the level of the fluid is equal in all 3 channels. Invert the cartridge lid and rest on a flat surface for 2 minutes. Visually inspect to confirm all the reagents are fully reconstituted. Holding the assay cartridge lid firmly, sharply flick the cartridge downwards, forcing the specimen to the bottom of each channel again. Immediately insert the assay cartridge into the Genedrive instrument. Push firmly until a click is heard. To start the test, press and hold the function button. The Genedrive instrument performs real-time analysis by continuously monitoring for the presence of a positive signal. A beep will notify the user when the test is complete. Positive results can be detected quickly in as little as 7.5 minutes, and negative results in 17 minutes. Test results will be displayed on the screen. When complete, remove the cartridge by pressing down the catch on the side of the cartridge lid and withdrawing. Immediately dispose of the assay cartridge as clinical waste. To avoid contamination, never attempt to remove the lid before disposal. To reset the Genedrive instrument, press and hold the function button for 3 seconds. The CE-marked Genedrive COV19 ID Kit provides a fast and accurate solution to detect SARS-CoV-2. Key product features include sensitive real-time detection of SARS-CoV-2 infection to quickly identify positive patients, a simple workflow that does not require pre-extraction, and a dual gene target to provide robustness against emerging SARS-CoV-2 variants. Available on a small portable device that can be used in many different settings. rapid molecular testing with a new Genedrive COV19 ID Kit. For more information, visit the website at genedrive.com.